morning we came that we realized, because we were thinking that overnight something will happen and this strike might be averted. But unfortunately, when we came this morning, we realized that indeed the strike has taken place. And so those centers, those other pandemic centers, as we may call it, we have doctors there currently who are attending to them. So, but this is a situation which cannot be said to be a sustainable situation. The nurses are very critical members of the health team, that their roles are critical, their roles are critical. And so there is no way that we can do this on a sustainable basis without the nurses coming back. The first thing we have done, after we have completed the rounds, we have updated our bosses, the Director General and the regional director. We have updated them for them to know the situation, because the hospital is not on its own. We are under the Regional Health Directorate and also under the Ghana Health Service headquarters. And so we have informed them about the situation. And then in-house, we are also encouraging the doctors to continue to hold the fort. We are hoping that it will be a short action, and that sooner or later, government will come in and then they resolve the action or avert it. And then we are relying on the doctors and then the few nurse IGF staffs, those that have been recruited, we have recruited ourselves for one reason or the other, who are on the hospital's own payroll. They are at post because they have to work to earn their salary, but they are very few. That is not the solution of the problem, because they are very few, not even up to 10, and they cannot do the work of over 700 nurses, which is the total number. For some of us, the more serious situation is even the COVID areas. This hospital, we provide general service and we also provide COVID services. Even on the COVID areas, the nurses did not come. And so that is a huge burden. It's a huge challenge. So definitely the absence of the nurses will have a big toll on clinical service delivery. And it's already having a big toll, because when you go to the emergency, you see that the doctors are left alone, receiving the new patients, managing emergencies, and the same doctors will now have to come and nurse the patient, administer medications, and this is extremely very difficult for them to do under the circumstances.